Hello friends, you may be aware that there is a lot of discussion about the EVD, that is, the Ebola virus disease. This disease is caused by the Ebola virus. It is a rare but fatal disease first reported in West African countries. One can catch Ebola from someone who is having symptoms of Ebola virus disease. Ebola virus can be transmitted by having contact with Ebola patient or with their body secretions like blood and vomit. But do remember, it is not transmitted through air. And also, it does not transmit unless patient has symptoms of the disease EVD. Even if the patient has the virus, it takes 2 to 21 days for the disease to develop. You have to take measures, first to safeguard yourself and then the passengers. The cabin crew attending to the sick person should be using the Universal Precaution Kit immediately as recommended by the International Civil Aviation Organization. It is very important to protect yourself before dealing with the sick person. Wear impermeable disposable gloves when physically attending to an ill traveler and coming in contact with body fluids, such as used tissues, blood, vomit, potentially contaminated surfaces or lavatories. Potentially contaminated objects should be disinfected as per the WHO guidelines. Hand hygiene is the most important infection control measure. Avoid touching your mouth, eyes and nose with unwashed or gloved hands. Do wash your hands with soap and water for at least 30 seconds after assisting ill travelers or coming in contact with body fluids or surfaces that may be contaminated. Authorities at the destination airport should be immediately notified of any ill travelers on board. Keep the sick person separated from others as much as possible, preferably at the rear isolated corner and earmarked toilet for exclusive use. Assign a dedicated crew who would exclusively attend to the sick person, and if the sick person is coughing or sneezing, provide a surgical mask. Also, ask the sick person and fellow co-passengers to sanitize their hands and gloves should be given to them. Remove the gloves carefully to avoid contaminating yourself or your clothing. Properly dispose of soiled gloves after use into a plastic bag and do not reuse. Your role is very important in preclusion of the disease, as early reporting, prompt management gives prognosis and prevents spread of disease. Upon arrival, inform the health unit staff at the airport about the ill traveler and assist them in tracing of travelers or co-passengers who came in contact with the sick person by providing list of such persons to the airport health officers. And the affected passenger should be disembarked at the end. Properly dispose of all contaminated items. Place all receptacles that have been used by the ill traveler as well as all bags containing materials used to clean up in a biohazard bag and hand it over to the health unit at the airport. Sanitization of the aircraft should be done in coordination with Airport Health Organization. Any airline crew who think they were exposed to Ebola either through travel, assisting an ill traveler, handling a contaminated object, or cleaning a contaminated aircraft should immediately notify their employer. They should monitor their health for 21 days, watch for fever, severe headaches, muscle aches, diarrhea, vomiting, rash, and other symptoms consistent with Ebola. If you develop such symptoms, you should immediately seek medical attention. Remember, your role in containment of the disease is very important. Your cooperation is therefore very critical.